Hello and welcome to SureenaSpeaks, and in this video I'm going to cover coronavirus because if you haven't already, I'm sure you'll be inundated with questions from patients and the public about what actually is coronavirus. So in this video I aim to cover exactly that, as well as the signs and symptoms of coronavirus and what treatment options are there and what advice to give to patients. So first and foremost, what is coronavirus? Well, it has nothing to do with the beer corona, so let's step aside from that. And it's actually a family of viruses. It's not just one single type. And it's existed for many years, and it can range from the common cold to more severe ones called Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. Now, what's happened in China is that there's a new strain that's been found, and it's called Wuhan novel coronavirus. This previously hasn't been seen in humans, and it's really sadly it's affected many people in China and even killed some people in China as well. At the time of making this video, it hasn't affected anyone in the UK. So usually coronaviruses are transmitted between animals and people. So something like the severe acute respiratory syndrome, that's transmitted from the civet cat. Now, bear in mind they're actually not feline, so it kind of gives cats a bad name, but Google it, civet cats. So it's translated from civet cats to humans, and civet cats is actually a delicacy in some parts of China, whereas with the Middle East respiratory syndrome, that's transmitted from dromedary camels to humans. So what are the signs and symptoms? Well, if you think about with most viruses, it's quite similar. So a fever can be expected, feeling quite tired. Particularly with this one, it's quite respiratory specific. So something like shortness of breath or difficulty in breathing, a cough. These can all be signs and symptoms of coronavirus. So there is no specific treatment for coronavirus as such, like with many viruses. It's more about managing and treating the symptoms. And because the Wuhan novel virus is a new illness, the following has been recommended because it's not really known how to stop it spreading from person to person, but if someone follows these recommendations, then hopefully it will minimize it. So simple things like washing your hands with warm water and soap, keeping your nose and mouth covered when coughing or sneezing. Some even recommend that when sneezing to actually sneeze inside the elbow and not in your hands, and also to thoroughly cook any meat or eggs. So if a patient has returned from Wuhan city in China in the last 2 weeks and they start feeling quite unwell, the recommendation isn't to go to the doctor or to go to A&E. The advice actually is that they ring NHS 111, because if it does happen that they do actually have this virus, we want to contain it, we don't want it to spread. So don't go to the GP, don't go to A&E, but do ring NHS 111. So I hope you found this video useful and that it did summarise for you the coronavirus. As always with anything, do make sure that you use reputable resources when you are signposting patients. So the World Health Organization website, for example, NHS, CDC website, because there's loads of articles and such likes that are being written about it, and they aren't always the best piece of evidence to use. So when you are giving your advice to patients, do make sure you signpost them to reputable sources. So I hope you found this video useful, and if you did, why not give it a thumbs up? Share, like, subscribe. Do also visit my Facebook, Instagram and Twitter. And until next time, happy watchings.